big announcement out of Ottawa for a lot of Canadians that, quite frankly, when money has been an issue, dental care is one of the things that they've just had to forego. It just hasn't been something that they've been able to fund for themselves. Where was your head at when you heard the announcement on Monday?
I would say 1/3 of Canadians who do not have private dental insurance that has a bit of difficult struggles to have proper access to oral health. If this has been played and designed very well, this could be a game changer for a lot of Canadians to improve their oral health.
So this is basically, as we read earlier, initially it's going to be for uninsured Canadians with a household income under $90,000, and applications will first be open to eligible seniors aged 87 and older. So that's a very specific demographic. And then, of course, the ages will drop down and applications will open up. They'll be phased in with a staggered approach. So I would imagine that this is the type of thing you're going to be wanting to tell people, don't cancel your existing dental insurance right now. What do people need to know? How should people be responding to this news?
Yeah, great question, Ryan. So basically, there's a lot of uncertainty and unknown factors with this program. So I wouldn't recommend to cancel your existing dental program. We just don't know too much of a detail in terms of what kind of services will be covered, if there will be any co-pay, anything like that. So just hold on to your existing plans. See your regular dentist to follow up with your dental concerns.
Is this something where people are going to be, I don't know if we know the details on this or not, are people going to be able to stay with their existing dentist, or are there going to be specific dentists that are funded by this? Do you know how that's going to go?
Yeah, that's one of the big concerns that we brought up to the federal health, because we do respect that every patient has the right to choose and see the dentist they want to see and receive treatment. So we don't want this introduction of the new program to interfere with the existing relationship between the patients and dentists, as well as their existing current dental programs.
So the first seniors we know, even that joined the program, won't be able to start making claims for dental visits until May. And we'll get details, I think, on what exact coverage dates will look like and how they'll vary from different people. But this is a thing where, while the announcement is made, this often happens with government funded programs, the announcement's been made, but for a lot of people, this isn't going to be a reality for quite some time.
Yeah, I would agree with you. I mean, the letter has sent out to the senior folks over the age of 87, I believe, and then the program doesn't really start till May of 2024.
So what for the average person is going, well, what am I, at the end of the day, what am I going to have to pay for dental care? I mean, there's some people that may not have seen a dentist for 20 years, quite frankly. Right. What would you tell these people that have that basic question?
So definitely we have some concerns with this existing current issues where financial is a big concern for people who are not able to receive or who are not able to see a regular dentist. And we're hoping with collaborating and discussing with the federal government in order to design this program so that it can be effectively and efficiently delivered to the people that would actually benefit from receiving dental care. So unfortunately, right now, we have a lot of unknowns. So Ryan, I don't really know what I would need to say to these patients, what will be covered or what level of care will be received for this.
Yeah, I mean, hey, sometimes it's just like we don't know yet, and I guess we're waiting to know. How have Alberta dentists been, like, consultation's obviously so big in all of this, and I do happen to know that your association had put a framework together. I think it was called a proposed framework for the Canadian Dental Care Plan, which was dentists across Canada that worked on that and contributed to it. Are you satisfied with the level of consultation? Like, did Alberta dentists have a say in how this was put together and rolled out?
Yeah, I mean, we were informed about this plan about 2 years ago when this was introduced to the public, and we've been reaching out to the federal health just to kind of collaborate with the ideas of concerns that we had. I mean, dentists are the experts of delivering the services, and we know what system works, and we know what functions, what policies, and what programs that would be effectively delivered to our patients. So we've been reaching out, we've been drafted that framework that you were talking about. Unfortunately, we weren't really at the table till basically the last moment. So I would say October, November was the moment we are actually able to sit down with federal ministers and health ministers to discuss about our concerns, and hopefully they were able to hear us out a bit more as the program rolls out.
What's this been like? How long have you been practicing, doctor?
So it's about over 10 years.
10 years. So you've got a good lay of the land. You got a good sense of it. I've always been kind of surprised that dental care has not been funded or treated the same as a lot of other healthcare. There's evidence, obviously, number one, that dental care is important, obviously, for people's mouths. But also there's links to like dental care and heart disease. And there's links to all of the things that maybe the average person doesn't spend too much time thinking about. As a professional and as a practitioner, are you surprised that it's taken this long for there to be any meaningful progress on publicly funded dental care?
It is unfortunate to, get to know some cases where people are delaying procedures or delaying treatments because of the financial burden on their shoulder. However, dentists like to focus on educating and also focusing on preventative care. So we're hoping this will be a bit of first step to help with people who do not have a private dental care, so they can see the regular dentist on a basis that they can bring up their concerns and then fix their issues on a timely manner, so it doesn't become a bigger unnecessary health damages. Because you're right, Ryan. Because oral health is a part of the overall health. Yeah,
and I happen to know that there's a lot of people. I'm just even thinking about in my own life. I'm even thinking about myself, doc. And I would like just even think sometimes, and I'm the worst. I haven't had my annual physical with my family doc for 3 years. My wife's grinding my gears on it, and she should be. She cares about me. My family doc left during COVID. He was one of those that left, and I've just kind of been like, I don't know, passively looking for another one, would have had a tough time doing it. Same with my dentist. All of a sudden, I'm getting these friendly calls from them. I'm realizing I haven't even been in for a cleaning for a couple of years. It's like, what am I doing? I'm looking in the mirror right now. Why am I putting all this stuff on the back burner knowing that these are going to be on, some of the professionals are going to be able to say to me, listen, you got an issue. We can see it here right now. I don't know. Maybe the average person maybe we haven't prioritized our health as much as we need to. What do you think?
Well, definitely a priority is a bit of a first step to understand and care about your oral health. But definitely we want to ensure that we want to focus on educating, because oral health is as part of your overall health. And we want to make sure, people have different needs. So we want to make sure this program has a certain purposes to help with people to achieve their optimal oral health.
Are you concerned about the impact that this might have on dentists? Like, I'm thinking like workload, administrative duties. What are the top concerns?
Yeah, like any other health sectors, we do as a dentistry suffers from staffing shortages. Dentistry is a very team-based industry where we do need a front-end staff, receptionist, assistant, hygienist, just all collaborating, working together. So having this new program implemented without too much of details outlined, it is a bit of a concern for us because we don't know how much of a workload or administration burden that will play in our daily work functions.
Doctor, before I let you get, you're at practice today. We should know you're working. I appreciate you stepping out to talk to us. Is there anything that we haven't touched on specifically relating to this announcement and this new dental care plan for Canadians? Is there something you want to make sure that people have on their radar as they're learning more about it?
Yeah, I think we should still patiently wait for the program to be unfolds. We need to understand what are the coverages for our patients, and we want to make sure that patients have that freedom to choose the dentist they like to see. We also ensure that they have easy enrollment registration process, reducing the minimum workload by reducing the amount of admission burden on our front end staff, because we do not want to have this mass amount of patients, but our providers are not able to provide the care because of the workload. So we want to have a good balance between the patients and the providers. We also want to respect the patients that already have existing private dental coverages. So we want to make sure there's no disruptions and these people are able to receive dental care, optimal high quality dental care from Alberta dentists to improve their oral health.
All right, good stuff. So people, I guess a lot of people, like when you say wait for more details, and some people have to wait to apply. I mean, if you're 45, 50, 60 years old, you're going to be waiting longer than those that are 85, which is great. I say, let our elders go to the front of the line. It's probably the way it should be. But at the same time, that means that some people are going to be waiting to book their dental care, right? For a lot of people, they're probably going to wait to book their appointment.
I would strongly encourage, if you have some dental concerns, seek care now, because things can be prevented and things can be treated well. And because delaying the treatments can only create more complications during the process. And like we were discussing about, oral health is a part of the overall health. So having some kind of disease in your mouth can cause some other disease in our overall throughout the body. So definitely, if you have some urgent concerns or some questions, issues, please see your regular dentist and address that before waiting for a plan that may not be suitable for your individual need.